Hello friends, this is Shubham, and today in this section I will be talking about the epilepsy. In the following sections I will be talking about the anti-epileptic drugs, their indications, their side effects and etc. But before talking about the anti-epileptic drugs, I have decided to talk about the epilepsy, that what is epilepsy, and after that we will talk about the anti-epileptic drugs, that how they're going to work against the epilepsy. So what is epilepsy? Actually epilepsy are the recurrent or repeated episodes of the seizures. So we should know about the seizures too before knowing about the epilepsy. So seizures actually they are the abnormal electrical representations of the neurons inside our CNS. So there will be the abnormal electrical activity in the CNS, in other words, which will lead to abnormal sensory motor or psychomotor experiences. And these seizures, if these seizures are occurring in the regular intervals of time, for example after every 6 months or after a year or after 2 years, like that, so those seizures would be considered as epilepsy. Only a single seizure would not be considered as the epilepsy, and those patients should not be treated with the anti-epileptic drugs. Actually seizures could be of two types: the pseudo seizures and the true seizures. The pseudo seizures may be symptomatic due to some kind of symptom, like due to hypoglycemia or due to high fever or due to any kind of pathology the patient may be suffering of. So true seizures must be treated with the anti-epileptic drugs. So now if we categorize the seizures, seizures have actually three types. So we are gonna classify seizures. We can classify seizures into the three types: partial seizures, about general seizures, and the unclassified seizures. Unclassified seizures. So partial seizures actually they starts from the single locus in the CNS. So in other words you can say only a part of the hemisphere of the CNS. For example, we have the two hemispheres in the brain, in the CNS. So only one hemisphere would be affected. Because of that we call it as focal epilepsy, partial or focal epilepsy. Focal epilepsy. And in general these are gonna affect both the hemispheres of the CNS, both the hemispheres of the brain. So that's why we call them as spread, because they are spreading in all over the brain, and these are more severe as compared to the partial ones. However, partial could be converted into the general one, and in most of the cases partial is converting into the general epilepsy or general seizures. Now these are, in other words you can say, spread for the learning purpose. Now let's categorize the partial seizures or focal seizures. So again they are simple partial seizures, complex partial seizures, and the secondary generalized partial seizures. These are the seizures which can convert into the general one and can spread into the CNS and can accompany it with the abnormal sensory motor or psychomotor experiences. So in simple one, let's talk about the simple partial seizures. In simple partial seizure, these are not so severe and these are not for much time as compared to the others. So simple seizures, the patient will not lose their consciousness, means they would know about the things, they would be know about their surroundings, so you can interact with them. and they can answer you. So there will be the no loss of consciousness. So that is the important point, that in simple partial seizures, the patient do not lose their consciousness. So without loss of consciousness, without loss of consciousness. Okay. And if you will talk about the complex partial seizures, then these patients are seen with the loss of consciousness, means they would not know about the surroundings. Okay, so these patients would not be able to interact with anyone. So there will be the loss of consciousness. In the simple one, there wasn't loss of consciousness, but in the complex one, there will be the loss of consciousness. And we have the third category, secondary generalized. Usually, more often they convert into the general one. And in general, we have the other classifications. So this was about the partial one, that the patient with the partial seizures, they could lose the consciousness in the case of complex partial seizures, or there may be the intact consciousness, means the patient could not lose consciousness, but they could have some seizures. For example, they could have the motor or sensory or psychomotor experiences, abnormal sensory motor or psychomotor experiences. For example, there could be the convulsions or there could be the jerks in only one part of the muscle. For example, in the upper limb, in hands, or in the lower limbs. It could be the clonus, it could be the contractions or convulsions. So this was all about the partial ones. And if you talk about the general seizures, there are the different categories, and we can also name them as spread seizures, because they are usually spreading in all over the CNS. Actually, from where it starts in the brain, there is the thalamus in the brain. For example, let me draw over here. If this is the brain, for example, okay, so over here, let's suppose this is the thalamus. Okay, so over here, this is the thalamus, and from the thalamus, this is our cerebral cortex. This portion is the cerebral cortex. So from the thalamus, the abnormal electrical signals are going to the cerebral cortex over here. Abnormal electrical signals from the thalamus going up to the cerebral cortex, and from there they are just firing down through the descending tracts. So usually this doesn't happen, that abnormal electrical firings. Usually we have the normally if there is the need for any contraction or for any relaxation of the muscles, so there would be the sensation, there would be the electrical signals according to that need. But in the case of seizures, there will be the abnormal motor firings or abnormal sensory. So this is the case what happens in the seizures. So there will be the abnormal electrical signals firings, abnormal neuronal firings in the CNS. So let's categorize the general seizures. What could be the categories? Here we have general, tonic-clonic seizures. Tonic-clonic seizures. Formerly it was called as the big seizure, because most of the patients are suffering from these kind of seizures, tonic-clonic seizures. So this was called as a grand mal or grand mal seizure. Grand mal seizures. Now next category is, this was a tonic-clonic. Next category would be tonic seizures. Actually in tonic-clonic what happens, that for example it is occurring in the upper limb, for example in hand. So there would be the convulsions, strong contractions in the hand, and there could be the jerk at the same time. So there would be the contraction, there would be the jerk of the hand. So these processes will occur simultaneously at the same time in the tonic-clonic seizures. But if you will talk about the tonic, there would be the only convulsions. And the next category, if you will look about clonic, means there will be the jerky movements of the hands, for example. Tonic, clonic, there could be the myoclonic. In myoclonic, only a single part of the muscle would be affected. For example, facial muscles would show the jerky movements or any hand movements in the hand muscles. So there could be the only a single part of the muscles are affected in the myoclonic. We divide it. Myoclonic. Also we have the atonic or akinetic. In these kind of seizures, general atonic or akinetic seizures, the patient will lose consciousness, immediate loss of consciousness. So the patient would not know what is happening surrounding them. So atonic or akinetic, the patient will lose all the tones and the patient will fall down suddenly. So that was the atonic or akinetic. One more type we have, the absence seizures, which is generally characterized in lower ages. For example, in the children's, absence seizures are much more often and they are more difficult to recognize. So one more, that is absence seizures. These are difficult to recognize the children's with such absence seizures because they are usually for about 4 to 5 seconds and they came in the regular intervals of time. So what happens in the absence, that the child is doing their normal activities, whatever they are doing, but in between while doing these activities, he will start to blinking his eyes or blinking her eyes. So they will start to blinking the eyes and stare at anything, for example at the wall. So these kinds of symptoms are seen with the absence seizures, and they are about, if you talk about the intervals, that they will be around 4 to 5 seconds, they will do such activities and they will come back to their normal activities. So generally these are very difficult to recognize in such patients. Normally, if you will talk about drug, however we will talk about the drugs in the next section. In the absence seizure, ethosuximide is the more successful in the age of children who are less than 2 years. Otherwise we use the valproic acid or sodium valproate. So these was about the general or spread seizures categories. Now if you talk about the unclassified, partial, general and unclassified. Unclassified, you can include the infantile seizure in the children's, in the neonatal, in the neonates, the seizures could be seen. So this is the unclassified form, infantile or neonatal. So this was about the seizures that we discussed about, that partial seizures, general and unclassified seizures. In the partial seizures, the person will stare at something. There will be the repeated movements, for example, the repeated chewing, repeated episodes of holding something, holding their clothes like that, and these are the signs of the partial ones. Partial, we call them as focal 2 because their locus is in only the one hemisphere, or they can cover only one hemisphere of the CNS of the brain. So these are the focal. Further, we studied that they could be divided into simple, complex or secondary generalized seizures. Simple, without the loss of consciousness. These patients won't lose their consciousness, but they would show some seizures. For example, atonic or convulsions or jerky movements. Complex, there would be the loss of consciousness too, along with the seizures. Secondary generalized, usually when partial seizure converts into the general seizures and shows the signs of general seizures, those seizures would be considered as the secondary generalized. In generalized, we know the spread, both the hemispheres of the CNS could be included. Okay, both the areas of the CNS, both the hemispheres of the CNS can be affected. Further, we studied that they could be divided into tonic-clonic, generalized tonic-clonic seizures. Valproic acid is the first line drug for such seizures. We will talk about the drugs in the next section. Tonic-clonic seizures, or we call it as the grand mal seizure. Tonic seizures, clonic seizures, tonic, the patients who suffer with the convulsions, strong contractions in the muscles. Clonic with the jerky movements. Myoclonic, only a single part of the muscle suffers with the clonus or jerky movements. Atonic or akinetic, the patient will suddenly fall down on the ground. They will lose all the tones of the muscles. About the absence, these are more seen in the smaller children's, young children's. And atonic seizure, actually, formerly they were called as the petit mal or small seizure. Petit mal or small seizures. Okay, there would be the alteration in the consciousness too, but that doesn't mean the patient will fall down or the child will fall down on the ground. There will be the altered consciousness, means they can't interact with somebody. But as I said, that they are very difficult to recognize because these are for the very small interval of time. For example, 4 seconds or 5 seconds or 10 seconds. For example, this was about the general one, and unclassified infantile or neonatal seizures. So this was about the seizures or epilepsy. In the next section, I will try to summarize the anti-epileptic drugs, that how their mechanism of action can prevent the epilepsy. However, remember that epilepsy, we can stop the symptoms of epilepsy with the anti-epileptic drugs, but we can't cure completely, or we can't heal epilepsy completely. We can only stop the symptoms of the epilepsy. Rather, we can cure it. So this was about the introduction to the epilepsy, about the seizures, their kinds. In the next section, I will be talking about the anti-epileptic drugs. Thanks for watching this video.